Thank you, Mr. Chair and members. I'm presenting two bills, SB 884 and SB 1113. These two bills are a result of a joint legislative audit committee request for an audit submitted by me and 9 other members of the legislature. The audit, which came out at the beginning of the year, determined that schools weren't providing sufficient record keeping on student performance outcomes, lack of state funding documentation, and also unexplained changes that were made in students' individual education plans. The audit related to the funds that were set aside and put in the budget 4 years ago regarding mental health care in the schools for our students. So in essence, we don't have any fiscal transparency about behavioral health services in the schools. These two bills seek to correct that. So the bills will provide information and seek transparency for giving both the public, the legislature, and the parents of children information regarding the mental health funds that were set aside. The bill, SB 884, seeks to provide fiscal transparency of mental health funds by requiring the special education local plan areas to report their allocations and expenditures to the Department of Education, and requires schools to give parents written notification of any changes in their child's individual education plan and report student performance outcomes. We had a hearing where we had a parent that a child that actually ended up committing suicide. The parents didn't even know what kind of plan and the changes in the plan for that child. It was a special hearing of the Senate Select Committee on Mental Health. Quite important to let the parents know what's going on. The measure ensures statewide transparency and accountability of mental health funding and provides assurance that our most vulnerable student population receiving the necessary services they need. Now, we are working with the committee staff on amendments that seek to reduce the cost of SB 884, and I urge support for that bill as it moves to suspend, Mr. Chairman.
Thank you. Witnesses in support.
Rusty Salix, California Council of Community Behavioral Health Agencies, sponsor of this legislation. Since the law changed to transfer the responsibility for mental health services, special ed students from counties to school districts, we have heard countless complaints from families, advocates, and others that many children are falling between the cracks, not getting the services they need. The current data the Department of Education collects can't seem to track this. It shows that overall, the same number of students being served with overall numbers of services, it's not getting us to the problems. So we need a better accountability system. This is a form of health care, and we need to have performance. We also need to find out where is it working well so that others can learn what are the approaches that will work best.
Thank you.
Linda Way with Western Center on Law and Poverty in support of SB 884. The department already gathers substantial data on each special education student, and adding the tracking for mental health services should not be that costly given their infrastructure, and is critical as seen in our report that finds that only 1 in 7 children eligible for mental health services are actually receiving them.
Thank you, Mr. Chair. Alice Kessler. I'm here on behalf of the Special Education Local Plan Area Administrators of California, and we don't currently have a support or opposed position. We have had some concerns with the bill as drafted. We've been providing technical assistance to the author's office, have been discussing the recent amendments that were cited, and will continue to be involved and shape that and hopefully bring down the costs, as we do agree with the analysis that as drafted there are several mandates. Thank you.
Witnesses in opposition. Finance.
We have not taken a position yet on this bill. The Department of Education indicates that it would need 2 full-time positions to monitor and review the data reported by SELPAs and LEAs and for various related activities. We do believe the bill would likely result in a significant reimbursable state mandate to reimburse SELPAs and LEAs for the costs they incur to comply with the bill's numerous new activities. Given that the bill would require SELPAs and LEAs to annually report to the department the frequency and duration of every related service provided to each of these persons, the expenditures for each service provided, and the data on outcome measures for each pupil, the cost to meet these new requirements could easily range into the millions and 10 million, so we concur with the analysis of the committee.
Thank you. Comments or questions from committee? Seeing none, Senator Bell, would you like to close?
Just that the audit pointed out that we give school districts specific money, not Prop 98, but it's a specific pot of money, over $400 million. And we don't know where it goes. So of course it's going to cost money to figure out where the money goes and whether or not it's going to behavioral health services in the schools for kids. It's important to know that information. Therefore, the cost of looking into where we spend the $400 million is appropriate, and the auditor recommended it. I urge and I vote on this when it comes off suspense.
Thank you. Without objection, we move this item to suspense file. Your second item, Senator Bell, is SB 1113. Whenever you're ready.
Mr. Chairman and members, this bill, SB 1113, responds to a key finding in Joint Legislative Committee audit. The audit found that local educational agencies, or school districts, and counties could benefit financially and improve student access to mental health services by joining forces to provide services to Medi-Cal-eligible students. The audit pointed out to specific school districts that are financially benefiting from contracting with their home county. We have a school district such as Mount Diablo, which is able to obtain roughly $1.3 million in federal funds per year from its county. And then the Desert Mountain SELPA agreement with San Bernardino County has allowed it to access almost $4 million in federal funds for fiscal year 14-15. The bill provides that financial incentives for LEAs through a competitive bid process to establish the demonstration partnerships with counties to deliver quality school-based mental health services to more children. The upfront investment to implement SB 1113 is dwarfed by the additional federal early periodic screening and diagnosis treatment funds, which is a mandate for entitlement for kids that are on Medi-Cal. This revenue would be received by the local educational authorities. In addition, the bill is under a wide spectrum of students who are not currently served who would become eligible for service, including prevention, early intervention, mental health services. They estimate that there's about 700,000 children with serious mental illness that are in our public school system, 700,000, just to give you an idea of the scope. Programs such as the Early Mental Health Initiative, Health, previously funded by the State Department of Mental Health, which no longer exists, shows that a majority of students who receive prevention and early intervention services avoid entering special education, a more costly system. I'd like to turn it to my witnesses, Mr. Chair, and who can speak about the cost benefits of this particular bill, SB 1113.
Witnesses in support.
Rusty Seelix, California Council of Community Behavioral Health Agencies, and sponsor of the legislation. As Mr. Bell pointed out, this model of partnership, and particularly the Prevention Early Intervention Program in Desert Mountain, SELPA, and in several schools in the Bay Area has proven to pay for itself by getting children help at the earliest possible sign. Unfortunately, our mental health and special ed systems are fail-first systems, and the reality is that there are many years from the time the child first has a mental health problem before the child gets help based on that current model. These types of partnerships, while yes, there's an upfront investment, have been shown to pay for themselves as early as the second year, and in all cases by the third year. We want to incentivize these partnerships between counties and schools to not only produce better outcomes in school and health, but actually to save overall costs for the schools and the counties.
Anna Hasselblad, on behalf of the Steinberg Institute, I would echo the comments of Rusty Seelix and ask for your support. Thank you, Mr. Chair and members. Again, Alice Kessler on behalf of the SELPA administrators. And again, we have a concerns position on this. Just to limit it to the fiscal, I think we understand the goal to replicate these models, which have been very successful. In particular, we are concerned with the allocation of AB 114 funds, which are funds set aside for children with IEPs who receive special education services for services for children who are not special education students. We think this may go against federal law, as the analysis pointed out, and special education is already woefully underfunded. Thank you.
Thank you. Witnesses in opposition? Finance?
No file.
Comments or questions from committee? Seeing none, Senator Bell, would you like to close?
Yes. Even if you just dealt with 125,000 kids that have IEPs and took those that have Medi-Cal, you would be able to develop a significant federal match, even if you just took those. And because right now, the local educational agencies cannot access early periodic screening, diagnosis, treatment services unless they contract with their counties. So what this bill does is it prevents California from leaving tens of millions of federal dollars on the table. It builds on successful models that are already out there. We would get more money for kids in special ed that need mental health services. And believe me, there's a lot of kids that need mental health services that are in special ed. I can tell you that right now. I urge an aye vote when this bill, on this bill, Mr. Chairman. Thank you.
Thank you, Senator Bell. Without objection, we move this item to the suspense file. We're going to move to working the rest of our agenda as we wait for a couple more members. We're going to begin with Senator Hertzberg's items that are on suspense and have waived presentation, beginning with SB 1029. Witnesses in support. Witnesses in opposition. Finance.
No file.
Comments or questions from committee? Seeing and hearing none, without objection, we move this item to the suspense file. Moving on to SB 1301. Witnesses in support. Witnesses in opposition. Finance.
No file.
Comments or questions from committee? Seeing and hearing none, without objection, we move this item to the suspense file. Moving on with Senator Bell's remaining items. SB 824. Witnesses in support.
Thank you, Mr. Chair. Matt Robinson on behalf of the California Transit Association. We're the sponsors of this bill. We're working to address some of the costs that were pointed out in the analysis by your staff. As to the ones that were raised by Caltrans and the Air Resources Board, we think that we're still in the early enough stages of the guideline development that the guidelines are continuously being updated, so now's the time to make those changes before those guidelines kind of become permanent. And so we'd ask for your aye vote when this bill comes back up. Thank you.
Thank you.
Mr. Chair and members, Bill McGavin with the Coalition for Clean Air. We've been concerned about the impacts on transit operations, so we're in discussions with the author and the supporters, but definitely agree that this bill should be considered as part of suspense.
Morning, Chair Lara and members of the committee. My name is Chelsea Tu. I'm a staff attorney with Public Advocates, and we really appreciate working with Senator Bell and the sponsors of this bill to amend the bill so that it protects disadvantaged communities and low-income communities of color who take the bus every single day. So on behalf of public advocates and 13 other organizations, including Transform, Asian Pacific Environmental Network, Housing California, as well as the Trust for Public Land, we as a group continue to oppose and express our concerns on the fiscal impacts of SB 824. So in addition to the impacts that are listed in the analysis, we think that the bill will likely place heavy cost burdens on the state's general fund and other public transit funding sources overall. Specifically, the bill would eliminate the overarching requirement for all projects funded by the Transit Operations Program to expand and enhance service. In other words, this bill would prioritize and incentivize large capital investments and therefore deprioritize funding for operations. And by increasing pure capital investments, the bill would decrease the amount of funding available for operations. And we think that this will then create extra pressures on general state funding to make up for the operation funding deficit. So thank you for your time, and we also concur with analysis to move the bill into suspense.
Thank you. Witnesses in opposition? Finance?
No file.
No file. Without objection, we move this item to the suspense file. Moving on to SB 955. Witnesses in support.
Mr. Chair, Senators Kobe Pizzati with California Association of Psychiatric Technicians. We're in support of this very humane and appropriate bill. Speaking specifically to the fiscal impact, I've spoke with the Department of State Hospitals, and they estimate they have roughly 60 patients that are terminal that would qualify for this compassionate release program at a cost of roughly $250,000 to $300,000 per patient. I think in all said and done, this bill would be a cost savings. Thank you.
Thank you. Additional witnesses in support. Witnesses in opposition.
Good morning, Mr. Chair and members. Corey Salzillo here on behalf of the California State Sheriff's Association in opposition to the bill, mainly policy concerns, but would point out that there's potential for local costs for these folks being transferred out of state facilities and into the local communities. Thank you.
Thank you. Finance?
No file.
No file. Comments or questions from committee? Seeing none, without objection, we move this item to the suspense file. Moving on to SB 1013. Witnesses in support. Witnesses in opposition. Finance?
No file.
Comments or questions from committee? Seeing none, without objection, we move this item to the suspense file. Moving on to SB 1291. Witnesses in support. Witnesses in opposition. Finance?
No file.
Comments or questions from committee? Seeing none, without objection, we move this item to the suspense file. Moving on to Senator Hernandez, 2 items, beginning with SB 932. Witnesses in support. Witnesses in opposition. Finance?
No file.
Comments or questions from committee? Seeing none, without objection, we move this item to the suspense file. Moving on to SB 1471. Witnesses in support. Witnesses in opposition. Finance?
No file.
Comments or questions from committee? Seeing none, without objection, we move this item to the suspense file. Moving on to SB 942 by Senator Liu. Secretary, witnesses in support. Witnesses in opposition. Finance?
No file.
Comments or questions from committee? Seeing none, without objection, we'll move this item to the suspense file. Moving on to Senator Nielsen's items, beginning with SB 950. Witnesses in support. Witnesses in, oh, here we go. Mr. Lovell. Buenos dias.
Yes. John Lovell on behalf of the California Correctional Supervisors Organization. We would take respectful issue with the cost estimates for this bill. In fact, this bill will result in cost reductions. Here's what happens now. Grievances of excluded employees go all the way up through the process, and they're denied. So the association representing excluded employees' only option is litigation. One of my clients, the California Correctional Supervisors, has totaled up about $1 million in litigation costs. Those costs are far greater than the minor costs of arbitration. In fact, this will result in cost savings. We support the bill, and we urge its removal from suspense at the appropriate time.
Thank you. Witnesses in opposition. Finance?
The Department of Finance is opposed to this legislation because it hinders the administration's ability to effectively manage state operations, alters existing laws and regulations surrounding excluded employees' rights through the precedential nature of binding arbitration, and creates significant unbudgeted state costs. A typical 2-day arbitration costs approximately $40,000 for the arbitrator, attorney's fees, court reporter, and fees associated with producing witnesses and legal documents. Historically, CalHR processes approximately 150 grievances per year for excluded employees. Conservatively, if 20% of these cases are elevated to arbitration, it would cost the state approximately $1.2 million annually. This estimate will likely increase significantly because the legislation broadens the scope of what can actually be arbitrated beyond issues impacting terms of employment. So we have considered the possibility of litigation savings, but believe that there will be net costs.
Thank you. Comments or questions from committee? Seeing none, without objection, we move this item to the suspense file. Moving on to SB 980. Witnesses in support. Witnesses in opposition. Finance.
No file.
Comments or questions from committee? Seeing none, without objection, we move this item to the suspense file. Moving on to SB 1295. By Senator Nielsen. Witnesses in support, please come forward.
Sean Hoffman with the California District Attorneys Association, with the sponsors of SB 1295. We would take issue with the cost estimate provided by the committee. We think that the information that we're trying to get in under this bill is already coming in as it is. This is just a more efficient way of doing it. Prevents us from having to bring victims in, have them testify to these things. So to that extent, we would dispute the referral to the suspense file, but recognizing that's where it's going, we would ask for the support at the appropriate time. Thanks.
Thank you. Witnesses in opposition. Finance.
No file.
Comments or questions from committee? Seeing none, without objection, we move this item to the suspense file. I'm going to just dispense with Senator McGuire's last issue before we bring up Senator Mitchell. This is SB 951. Witnesses in support. Witnesses.
Thank you, Mr. Chair. Matt Robinson on behalf of Sonoma County in support.
Thank you. Witnesses in opposition. Finance.
No file.
Comments or questions from committee? Seeing none, without objection, we move this item to the suspense file. We have Senator Mitchell here, who is presenting on 3 of our suspense items. Please come forward. We'll begin with SB 1322. Senator Mitchell.
Thank you very much, Mr. Chair. Good morning, colleagues. And just again, sir, we've agreed to waive presentation on 1034 related to autism services.
Correct.
It was keyed right at 50K, and so we waive presentation. I appreciate that.
Thank you. Appreciate that.
So SB 1322 is a bill which will protect victims of human trafficking by decriminalizing prostitution for minors. Under California law, a child who was under the age of 18 cannot consent to sex, and yet we charge the victims of commercial sex trafficking with a crime, crimes like prostitution. Under current law, a victim can be detained in juvenile hall and prosecuted for prostitution. This is not appropriate, effective, or ethical, nor is it an ethical response to this growing epidemic. In 2014, Senate Bill 855, a budget trailer bill, was signed into law by Governor Brown. This bill allocates $14 million in ongoing funding split between CSEC training for county workers and foster care workers and launching the new program, the Commercially Sexually Exploited Children Program, CSEC is that acronym, which provides counties child welfare services with funds for prevention, intervention, and services for CSEC victims. Even though 8B 855 was directly set up to identify a clear path to the dependency court system for these victims, these CSEC victims are still being prosecuted through the delinquency court system when they're arrested, again for prostitution, loitering, or a similar crime as a result of his or her victimization. SB 1322 is in keeping with this shift in policy that this legislature initiated. The bill will stop the criminalization of CSEC victims by decriminalizing prostitution charges for minors. It is determined that the person suspected of soliciting prostitution is under the age of 18. Law enforcement, as a mandated reporter, shall immediately report any allegation of commercial sexual exploitation to the county child welfare department. As the analysis states, the bill will create significant cost savings for juvenile detention facilities and county probation departments for victims who would otherwise be arrested and made delinquents of the court. The analysis also discusses a $125,000 general fund cost for one-time initial screening and assessment of CSEC eligibility. We would like for the committee to recognize that those funds should not go through the general fund, but through the $14 million that is allocated for CSEC victims through the budget trailer bill of 2014. Speaking in support today is the one and only Frank Mecca from the County Welfare Directors Association, and I believe Jackie Wong with the National Youth Law Center may be here as well. I ask for your favorable consideration.
Thank you. Witnesses in support.
Thank you, Mr. Chair. Frank Meck, I'm the Executive Director of the County Welfare Directors Association. And as Senator Mitchell stated, we think this bill is completely in keeping with the direction that the legislature already set forth 2 years ago in SB 855, a direction later confirmed in federal law that minors who are sexually trafficked should be treated as victims of child abuse, not perpetrators of crimes. And it seems inconsistent with that policy to have a penal code on the books that allows for the criminal prosecution of minors for what is essentially rape. With respect to the fiscal impact on the bill, as we see it, I mean, we run the system that you would prefer to see these victims served in the child welfare system. From our standpoint, you set forth that course in SB 855, and then the federal government essentially confirmed it. So to the extent that there's sort of fiscal ramifications, we don't see it as a function of a decriminalization bill or a non-criminalization bill. It's merely the manifestation and realization of the policy that you've already enacted, a policy that we agree with. And so for those reasons, we'd support the bill.
Thank you.
Is in opposition? Please come forward.
Sean Hoffman with the California District Attorneys Association. We're opposed on policy grounds.
Thank you.
Ruan Dozier with the Sacramento District Attorney's Office. We are opposed.
Laura Tanny with the San Diego County District Attorney's Office in opposition.
Jonathan Feldman with the California Police Chiefs Association in opposition.
Finance.
No file.
Comments or questions from committee? Seeing none, Senator Mitchell, would you like to close?
I would just say that I believe we have a responsibility as one of the 3 major human trafficking hubs in the U.S. to make sure that we're doing all that we can to protect and provide appropriate services to these minor victims of a crime, not perpetrators of a crime, and I ask for your aye vote.
Without objection, we move this item to the suspense file. Moving on to your SB 1335.
Thank you, sir. Colleagues, SB 1335 will help community clinics more easily provide substance use disorder treatment and medically necessary specialty mental health services to our most vulnerable communities. This bill will allow FQHCs and rural health clinics to elect reimbursement on a fee-for-service basis instead of the prospective payment system basis, also known as PPS. This expands the services offered and provider types available at FQHCs and rural health clinics. Page 1 of your analysis lists one-time costs related to the department seeking necessary federal approvals for the new payment process and a statewide recalculation of the PPS rate for clinics to adjust the cost of providing drug, Medi-Cal, and specialty mental health services, estimated to cost $5 million for an estimated 500 clinics who may seek recalculation. With regard to recalculation of PPS and the costs related thereto, we are very concerned that this conclusion is inaccurate and represents a misunderstanding of the bill's effect. We do not believe recalculation-related costs will approach anywhere near $5 million because we don't think that many health centers will open their rate to, quote, carve out services. Rather, we believe this is an opportunity to expand and offer additional services on top of those they are already providing under their existing PPS. In talking to the health centers who already do these specialty mental health and drug Medi-Cal contracts, or hope to start offering services under the new DMC waiver, all health centers see these contracts as an expansion of services on top of those services provided under PPS. What this bill does is clarify to health centers, counties, and the state that when FQHCs and counties contract to offer these new services, they are not to build those costs into their PPS rate. And as we continue the conversation in the legislature about how we end homelessness in California, access to supportive health services is absolutely critical to a successful statewide strategy to end homelessness. We are working closely with the Department of Managed Health Care Services for technical support to make sure the bill works within their current billing and coding system. Here today is Megan McCammon with the California Primary Care Association, who are the bill sponsors.
Thank you. Witnesses in support.
This is Megan McCammon with the California Health Plus Advocates representing California's community clinics and health centers, the bill sponsors. This bill was created in response to the new drug Medi-Cal organized delivery system waiver and California's recognized need to expand the delivery system for drug Medi-Cal and specialty mental health services. FQHCs do already participate in both the specialty mental health and drug Medi-Cal delivery systems, but not to the extent that they want to or that we believe they can to deliver these services, because there is little to no guidance in the law about how FQHCs can do so. There's no streamlined process for them to do so. This bill will clarify existing policy in order to provide explanatory language to DHCS, to the state, to counties, and to community clinics and health centers for how to participate in the delivery system if counties elect to contract with FQHCs as providers for the drug Medi-Cal or specialty mental health delivery systems. The purpose of this bill is really just to expand access to behavioral health services for those who are most in need.
Thank you. Let's make sure we stick on to the fiscal components of the measure. Go ahead.
Good morning, Mr. Chair, members. Martha Guerrero, representing the Los Angeles County Board of Supervisors, also a co-sponsor of the bill. And as you heard, Senator Mitchell and the issues she's addressed, and we concur with those issues that she's addressed, and we ask for your favorable consideration and request to remove it from the suspense file. Thank you.
Thank you. Finance.
No file.
Comments or questions from committee? Oh, opposition. Witnesses in opposition of the measure, I'm sorry. Okay, finance, no file. Comments or questions from committee? Senator Mitchell, would you like to close?
I'd ask for your aye vote.
Thank you. Without objection, we move this item to the suspense file. Moving on to SB 1380.
And last but not least, Mr. Chair and members, SB 1380 will clarify that California is a housing first state and establish the California Homeless Coordinating Council. The bill will require that departments administering state programs targeted to address homelessness collaborate with the Coordinating Council to incorporate the core components of Housing First into their programs by July 1, 2019. Housing First is an evidence-based model that uses housing as a tool rather than a reward for recovery, and that centers on providing or connecting homeless people to permanent supporting housing as quickly as possible. 1380 is a cost-effective way to help our state transition to an evidence-based, cost-effective housing model that can effectively house our most vulnerable homeless residents. As such, the analysis lists minor fiscal impacts associated with the bill, which are centered around startup costs of about $200,000 to the Department of Housing and Community Development to staff and facilitate the Coordinating Council's meetings in collaboration with agencies on the goals outlined for the council in the bill. The analysis also lists that there are potential costs to the Department of Social Services and the Department of Corrections and Rehabilitation Division of Adult Parole to bring their existing housing and housing-related assistance programs into compliance with the core components of Housing First. The Coordinating Council, however, lists under its goals the implementation of Housing First along with collaboration between agencies and identifying resources, benefits, and services in order to help state agencies with their transition to a Housing First model. Costs associated with compliance with Housing First are included as part of the costs associated with the Coordinating Council. They are not a separate additional cost. Additionally, we know that realignment dollars from the Governor's Recidivism Fund in SB 105 of 2014 are already going towards successful rehousing of parolees, which makes up a sizable portion of the current homeless population. The bill has recently been amended in Policy Committee to explicitly allow for these types of projects, helping to transition any remaining programs into Housing First.
Thank you. Witnesses in support. Witnesses in opposition. Finance.
Department of Finance has not taken a position on this bill. Other than revising or adopting guidelines and regulations, the bill primarily describes a series of goals for the council and not specific tasks or requirements that may be assigned to HCD staff. At a minimum, we're predicting a cost of $161,000 annually. However, it's difficult to accurately quantify the costs that would be incurred to staff the council depending on the scope of their duties. These costs would likely be funded out of the general fund.
Thank you. Comments or questions from committee? Seeing none, Senator Mitchell, would you like to close?
Only through a coordinated, focused, committed state response as facilitated through the examples of other states that have statewide coordinating councils and what we're trying to do with SB 13, can we begin to meaningfully, as a state, address the homeless crisis affecting our fellow Californians. And so I ask for your favorable consideration.
Thank you. Without objection, we move this item to the suspense file. Thank you, Senator Mitchell.
Thank you, sir. Appreciate it.
We're going to return to our agenda in file order. We're going to take up next my items, SB 958, witnesses in support, witnesses in opposition, finance. Comments or questions from committee? Seeing none, without objection, we move this item to the suspense file. Moving on to SB 997, witnesses in support, witnesses in opposition, finance. Comments or questions from committee? Seeing none, without objection, we move this item to the suspense file. Moving on to SB 1139, witnesses in support, witnesses in opposition, finance. Comments or questions from committee? Seeing none, without objection, we move this item to the suspense file. Moving on to SB 1328,